Welcome back to UC Davis Live. I'm Satirius Johnson. Keeping tab on any contagious virus is key to stopping it from spreading, and the sooner you know about cases, the better chance you have to prevent an outbreak. Healthy Davis Together and the City of Davis have developed an early warning system to detect spikes in the presence of SARS-CoV-2, the virus that causes COVID-19. They're doing it by looking for the virus in the city's wastewater. It's just one of the ways city officials and public health experts are getting a leg up on the virus. And as case numbers and testing rates decline, this wastewater monitoring program could become the very best way of determining the official end of the pandemic. Joining us today to discuss the program are two of the experts implementing the effort here in Davis. Heather Bischel is an assistant professor in the Department of Civil and Environmental Engineering at UC Davis. Through the partnership with Healthy Davis Together, she directs a citywide environmental monitoring effort to survey the virus in our wastewater, as well as in surface samples and HVAC systems. And Stan Grichko currently serves as Public Works Director of Utilities and Operations for the City of Davis. He is responsible for city operations and planning for the implementation of Healthy Davis Together's wastewater sample testing programs. Thank you both for coming on today.
Thanks for having us.
Thank you.
So before we get started, I just wanted to remind viewers that this is a free webcast. You can watch it live and watch it after the live broadcast on the UC Davis Facebook, Twitter, and YouTube channels. We're aware of others posting links saying they have to pay to watch this video. Please do not click on those links. This is a free webcast. And we are taking audience questions as always. So if you're watching this live, just leave them in the comment section and we'll work in as many as we can. So Stan, let's start with you. How does the City of Davis manage this wastewater monitoring program?
Well, the city, along with many other agencies, is required as part of any wastewater treatment to monitor for certain constituents. Wastewater is a normal byproduct of human action, and we monitor for many different things, as our normal regimen. But we also have the ability, at need, to monitor for viruses that can create issues for communities. Polio, hepatitis A, two examples of viruses that have been monitored for in the past successfully in wastewater. And in that context of this pandemic, we have ramped up and has focused our efforts along with our partners in HDT to look at the virus that causes COVID-19. As you mentioned, the SARS-CoV-2 virus can be shed in the stool of the community, those infected. And we have that ability to pick that up within our sampling. In many cases, before those individuals are even aware that they may be infected with the virus. We have set up a number of sample points throughout town, roughly 25. That does vary, but 25 different points around town and at our wastewater plant. And we collect those throughout the week. About 3 times a week we do that. And it assists the team in identifying specific areas that we might want to message out to the community if we see a higher presence than what we normally have been seeing in those specific areas.
Right. So how narrowly can you pinpoint it? Is it down to a neighborhood or down to a block? I mean, how closely can you kind of narrow it down?
Yeah, it does depend. Typically neighborhood is the range we're looking at now. We don't do individual testing. We don't test individual homes. This is about regions within the city, and it helps us focus that messaging into those areas. We certainly do not go into individual homes and test for that one area.
Right. So there's no personally identifiable information collected through the wastewater testing program.
Absolutely not. This is not localized to an individual. This is about a region within the city.
Okay. So if and when the city finds a spike or a potential spike of virus in a certain neighborhood or area, how do you then alert residents? And then what other actions does that trigger?
So there's certainly a lot of messaging that goes on around this program already. We have a website that we update weekly with all of the data. And then if we do recognize there's an area that we might want to message directly, we can do it via either door hangers or we have a couple different ways through social media to message that out as well.
And have you done that already? This has already happened on a few occasions?
We have localized some of our messaging in a couple instances. We have not done door hangers to date. We have those ready to go, but we have used some of our social media communication tools to get the word out to certain areas, and primarily to encourage individual testing at that point to see if we can if those individuals can identify and potentially isolate if they do in fact have the virus.
Right. And what has the response been from residents who've gotten those messages? Is it one of appreciation or one of what was the response basically?
I think in general the response has been positive to the outreach and communication that the partners have provided. Certainly, there's that idea around, well, what is this sometimes, and that's why we've tried to certainly enhance our messaging ahead of time. Right, the first indication a group or an area should get is not us sending out a message, you should get tested, there's virus in the area. Right, it's this is what we're doing. We're testing routinely. We're trying to help the community identify and understand what's in those neighborhoods, and then trying to assist and encourage them to have that individual testing to try and prevent the spread.
Right. Okay. Just a reminder, we are taking audience questions. So if you're watching us live, just leave them in the comments section and we'll work in as many as we can. Heather, I was wondering if you could talk a little bit about the advantages of wastewater monitoring.
Sure. Well, in Davis with HCT, we've had such a robust and accessible testing program where people can go any day of the week for a free test, and that's really the best way to identify cases and to help prevent the spread of the virus. That's not the case everywhere. So wastewater is particularly valuable and has been really valuable in areas where case testing is quite a bit lower, and especially for asymptomatic individuals. So, in communities where people are only getting to get tested if they experience symptoms, there's a lot of spread of the virus by asymptomatic cases. And so wastewater is an aggregated way, relatively low cost, because you can take one sample that represents the entire city essentially, or regional areas, neighborhoods with hundreds or thousands of people within them, and get a sense of the trends of spread of the virus in that area without somebody going to testing and going and getting tested. And so that ends up being useful if you can get the communications out to that area to say, hey, something's going on in this area, even if we don't know who it's coming from, we know it's around there. So let's double down on what we already know works in terms of masking, going and getting testing if it's available, socially distancing, and all of the things that people have been doing, throughout the entire pandemic.
Right.
So wastewater at this point has been really valuable in the current term. And just to kind of finish up, another advantage is over the long term, because wastewater testing can continue to go on when testing isn't needed quite as much. And in the city of Davis, we still are encouraging people to go out and get testing within Healthy Davis Together, because we have that facility available. There are variants that are circulating. We want to make sure to stay on top of any potential recurrence or resurgence of any kind. But as testing goes down, wastewater can help keep tabs on whether the virus comes back into the community, maybe in some modified form, and sort of nip it in the bud before it gets too far.
Right, that's great. You kind of addressed my next question. So moving forward, even after hopefully the pandemic is behind us, maybe people aren't testing as often, you can still test the wastewater. You've got that set up already, and so that can serve as basically an early warning system that maybe something has come back.
Yeah, well, the way that we set it up in partnership with the city, it really makes that possible both within the sewer system to look at neighborhoods, so we can be more refined than this has come back to the city as a whole. Right now, the levels in the wastewater are very low at the city scale. So we should be very proud as a community, I think, of how we've been responding to the pandemic. But if it does come back, we have the ability to then analyze this at a neighborhood level and let people know, because we have this communications pipeline and a committee of individuals who, with the city, with HDT, with UC Davis, that can come together and look at the data and interpret it and try to get that information back out to the people who are potentially impacted by it.
Right.
So we have the ability to do that in the long term. In terms of, how long would this continue? I mean, it's a question of, funding sources in the future. If federal funding can come in, state funding, We've seen in this pandemic that wastewater has a lot of information that can be really valuable. There's been a ramping up of getting that access to that information, and only in cities who have been able to develop those partnerships relatively quickly. There's a lot of communities that aren't being reached by wastewater monitoring, and there's an opportunity here to think about over the long term and in preventing future pandemics and getting the infrastructure in place more broadly, learning from all of the lessons right now to extend wastewater monitoring over a longer period for public health information.
So Stan,
go ahead.
Oh, no, I just wanted to ask Stan, so for other cities who may be listening in, or people living in other cities listening in, how easy is it for other cities to kind of set up a system like this to monitor the wastewater? Like, are wastewater systems or sewage systems set up essentially the same way across the country, and that you can have localized sampling sites?
Sure. Yeah, it's logistically, it's not that difficult. I mean, at the plants, and like Heather was saying, at the plant, absolutely, we're already set up to monitor. We already sample. Other agencies throughout the state and the country are already set up to sample. That's going to be a normal activity they're already doing. And then most agencies are going to be sampling have the capability of sampling in the collection system out in the city to a certain degree. Obviously, with what we've partnered with here and what we've done here, we had to ramp that up to a different level, which, as Heather mentioned, takes funding because the samplers are not cheap. And most agencies don't have 25, 30 samplers laying around that they have at the ready, if you will. So that takes some effort, but logistically, it's not that difficult to set up. It's more identifying where in the system you want to sample to get the best information from the results, and that's what I think took us the most time was just looking at our system and understanding where we could get the best results with the sample quantity that we were going to be taking. So for another agency, if they kind of look at that ahead of time and be prepared with that, it's just that much sooner that they can get out in the field and start getting those samples done. And then the other part of that, though, is having the capacity for the analysis. And that's where Heather and her team have really ramped up, certainly over the past 8 months when we were starting to talk about this. So that's the other piece that some other agencies may not have that capacity right at the get-go. Yeah.
Right. Heather, this is probably a question for you. Caesar, who's watching on Facebook, asks, can COVID-19 live in the water? For how long? And what types of water can it live in?
That's an excellent question and a really important question, because at the beginning of the pandemic, we weren't sure. And we're talking about a virus here. So rather than saying live, we think about can the virus infect a person? And so the question is, if we drink water, for example, can we be infected by the virus? And the answer is no, it doesn't remain infective in a water system or in wastewater. It's not a transmission route for the virus, but we can still detect the genome, the RNA of the virus. So when it's excreted from our body, if we're infected, then it ends up in the sewer system. There's a lot of other chemicals, and it's being beat up by everything around it, essentially. And it travels its way through the sewer system and gets to the influent of the wastewater treatment plant. It takes a little bit of time for that to happen. So it's getting beat up all along the way, but we can still see fragments of the genome that are present. And we target those fragments of the genome, and that allows us to detect its presence and to quantify it. And the quantification for us is important because then we can look at changes in the levels through time and see if it's going up or going down. And others all over the country have been doing this as well and looking at ways to do that better so that it better reflects what the actual case counts are, we know from clinical rates. Right. So the straight answer is you shouldn't worry about it in terms of an infection route, but the RNA does stay detectable for quite a bit of time in wastewater.
Now, can this kind of wastewater monitoring detect the presence of new, potentially more dangerous variants of COVID-19?
Yes, the short answer is yes, the longer answer is it's not easy. So the concentrations in wastewater, think about one person shedding virus into a network that collects from 60,000 people or more. We're a relatively small city, so it's not diluted as much as other areas. But if then you're starting to look for little changes along the genome, we can use sequencing of the virus genome itself to try to look for those changes that characterize the different variants. But that's a lot more difficult to do.
Right. Don't you have to know what you're looking for, though? Or can you just find variants on your own without actually looking for a specific variant?
There are different ways to go about it where we know there are certain variants that we can look for, and there are changes in the genome that can be targeted to be able to look for the genotype of a new variant. And there are sequencing approaches that allow looking more broadly at, for something that we might not know is present, for changes in the genome that we wouldn't have expected. The challenges with an environmental sample is that you have a lot of competing factors in the analytical approach, and getting all of that data assembled and together to be able to really confidently identify new variants from the wastewater is possible, and people are doing it. We're not doing that right now in Davis. We're focusing on this, the wild type, and then there's the variants are being detected through the clinical pipelines. But it is possible to do to help be anticipatory of potential changes that might occur in the future.
Right. So how long has this wastewater monitoring project been going on, and how many times have you kind of triggered that alert out to the neighborhoods that have been affected with a rise in or a spike in the the level of virus in the wastewater?
I'll maybe respond to that first, just from a general perspective, and then Stan can provide some details. But the actual communications alerts we've used sparingly, because these are, it is a very targeted messaging, getting an email or a text message that you've opted into for the city communications, but we were respectful of, when to use that signal. And so we want to be confident that the change we see is significant relative to what it was before. So we take that decision, or we don't take it lightly.
Right.
But we do update the website on a weekly basis with the new data, and we provide interpretation of the data as a slope over the last couple of weeks to say the levels are staying about the same, the levels are increasing, or the levels are decreasing in a particular region. So really, we provide that information on a weekly basis, but to actively send out messaging through the social media pathways, we want to only do that when we're wanting some significant response to it.
Yeah, and I would say the program itself we've been doing it for many months now, but it started, like I mentioned earlier, at the plant was the easiest to initially start because we were already set up, and then it took a good month for us looking at our collection system to decide. We started out with about 8 areas of the city that we sampled, and then it basically grew from there. So we've been adding capacity for the past few months as well, and that includes adding assistance from temporary workforce to be able to go out and sample and collect. And we started with we were doing once a week, twice a week. Now we're up to 3 times a week from those sites. So it's been an ongoing process. But we ramp it up as our capacity expands.
How quickly can you? Do you want to add something? No. So I guess, Heather, this would be a question for you. How quickly can you turn around? Once you get the sample to finding out what the level of virus is in it.
So this is actually another area where we've been improving through time. When we first started working on this, it took us about 48 hours. So we take the sample back into the lab, we pasteurize it. So we do a heat treatment so that it's safe for our lab team to work with the sample. And then in our previous method, we were manually concentrating the sample and then performing a manual extraction and running it through PCR. That took about 48 hours. And then we've incorporated now some automated components where we use magnetic beads and a automated magnet system where we can skip some of the manual filtration steps, and we can get the data around in about 24 hours from the time we get the sample. It can happen if people stayed pretty late, it could happen in a single day, but we usually let them send the data the next morning.
So that's pretty quick. I mean, the city, could really turn around if there was some big spike suddenly. Within 24 to 36 hours, you could get the word out that people in a certain area really should get tested and maybe think about isolating or maybe quarantining.
Yeah, exactly. I think the challenges are, now that the levels are quite low, there's a challenge and an opportunity with the wastewater monitoring. The challenge is that small changes in the data may indicate, there's a few people or even one person that's causing that change in the data. And so, sending out a message would be important to help prevent additional spread. But it's also a challenge to make sure that we're really seeing that change in significance. So we do that pretty carefully, and we have replication of our data, and we're working with the statisticians to, build out some models that help us do that and understand the uncertainty around making those decisions.
Has Healthy Davis Together gotten any interest from other cities, other university towns, or just other cities in general about, maybe trying to implement something like this in their towns?
Well, since the beginning of the pandemic, the wastewater monitoring has really bubbled up in a lot of other places. So we're not alone in doing this. There's a network, and actually the California Department of Public Health has helped coordinate a network of many different cities in California. The CDC and a national wastewater surveillance system has been set up trying to capture wastewater from something like 10% of the nation's population to try to use it as a tool to inform public health. So we're not alone in trying to use this tool for the benefit of our community. What we are doing that's different is the neighborhood scale monitoring, and really getting that information back out to people as much as possible. That's a lot more difficult to do at a city scale. You can do broader announcements, but here we can help tailor information and try to send it back to where it came from more specifically.
So as far as like a state of the state of the wastewater monitoring system, as far as like the level of concern, I mean, you say the incidence of cases in Davis they're very low, which is really great. There have been many different kind of screening systems. You have people testing individuals. We have the wastewater. So, I mean, how would you describe basically the state of the virus right now in the city of Davis?
I would say, based on the data that we're seeing, I mean, it's extremely low. So I think with this partnership with HDT, with all of the work that they've done with the community, and advocating for the distancing and the masks, and also the individual testing on a regular basis, I think it's shown that the community's really stepped up, and I can say with confidence that we've prevented many number of cases or spread through this effort with HDT. So I would say we collectively, the community, have done a great job in limiting the spread of the virus in this area.
Yeah,
Jessica, go ahead, please.
Just add to that, I agree. I think that the levels are low, and we see that in the wastewater. But it's not gone all the way yet, right? And I think it's kind of like the last mile of the marathon. And maybe we're not quite to the last mile yet. Maybe we're in the last half. I don't know, because it can drag out for quite a while. And I think that's the challenge, to work towards eradication, and to try to keep paying attention to the variants that can come in, because we've seen certain variants are able to, evade the vaccination systems, and we need to pay attention to that, because the virus isn't gone from all over the world. It can continue to change, and so that's why this kind of tool continues to be important, is because we don't know what will come next. We're doing a really great job with what we know right now with the vaccinations. There are still new cases that pop up in town. It's quite low, but there are new cases, and we want to make sure that we're paying attention moving forward.
So Jessica, who's watching on Facebook, asks, are you also monitoring for other coronaviruses, such as particularly the canine CV variant, which was found to be transmissible to humans a few years ago, although no human-to-human transmission was ever demonstrated?
Short answer is no. We are focusing on SARS-CoV-2 for the purpose of this pandemic, but she brings up a great point. He or she brings up a great point about the potential for wastewater and its information that it can provide for other types of pathogens. Stan talked about the different water quality parameters that are monitored regularly in wastewater. A lot of those are physical parameters, and there are some indicators of pathogens, but the pathogens themselves are trickier to analyze generally. But any pathogen that's excreted into the wastewater and that persists down the sewer system could theoretically be detected through the kinds of methods that will, the sampling and the analytical methods that we use.
Okay. And we have a question from YouTube, the person asking, could you now or with future advancement technology detect who the person was if they are in an accessible DNA database? Like who was infected, who was the infected person?
No, we don't have any information on individuals or human DNA that comes from this. We use a targeted quantitative PCR assay that really goes straight for the pathogen. And so we don't have any information that connects the samples to individuals in any way. And there would be no way to do that.
Right. So kind of to wrap up, I mean, looking to the future, how can this wastewater testing infrastructure be used to improve public health like after COVID-19?
Well, I could jump in. I mean, again, the infrastructure is there. And as Heather mentioned, you know, any pathogen, if it's shed into the wastewater and it can exist or last enough to get to the influent of the plant, we can test for any number of things with the right setup. You know, pathogen control from a wastewater perspective, typically you're focused on what's being discharged from the plant, not what's coming in, right? So, because the idea around wastewater treatment is to remove or inactivate either the viruses or the bacteria that can create human health issues, right? I think, you know, this idea around testing on the influent for some of these to use as an early warning tool, it's not new, but I think now you're seeing that. I think there probably would be some state or federal interest in encouraging that from a number of agencies, and then potentially providing for some additional infrastructure with Heather and with the analysis side of the house, if you will, to make sure that we can do that. You know, how we go about that, there's a lot of conversations that would have to take place on well, what are you testing for now? What makes sense? You know, what is going to give you the best opportunity to help prevent some of these things in the future or provide an early warning in the future. So I think there's a lot of conversations that still have to occur around that.
Any closing thoughts from Heather?
I think Stan put it pretty well. And, you know, we've been learning a lot over this time period. And it's really this collaboration between universities and public agencies that have facilitated both here in Davis and in other cities. I think that over the long term, in terms of informing public health, there's a lot that we still don't know, but at least in this particular area, we've seen mobilization very rapidly across many different universities to try to help us gain so much new knowledge that would normally take decades to get, right? But there's so many people working on really similar topics where we're finding how to go about using wastewater influent as a way to inform public health. But that doesn't happen without really this close collaboration between cities and researchers and universities that we've been able to do.
Well, this has been really great. Thank you so much for coming on today and sharing your work with Healthy Davis Together.
Thanks for having us.
Thank you. Thank you very much.
Heather Bischel is an assistant professor in the Department of Civil and Environmental Engineering at UC Davis, and Stan Grichko is Public Works Director of Utilities and Operations for the City of Davis. Until next time, I'm Satirius Johnson, and this is UC Davis Live, COVID-19.